If you are applying for healthcare product manager jobs and you're not hearing anything back, it's probably not your experience. It's not that you're unqualified either. It's that your application is triggering quiet red flags that you don't even realize that you're sending. Healthcare is complicated. It's regulated, it's political, and it's operationally complex. And hiring managers are screening for very specific signals. Hi, I'm Jennifer Rist. I'm a senior global platform leader at a leading healthcare tech company where I manage cloud-based SaaS products. And today I'm breaking down the 5 mistakes that quietly kill healthcare product management applications and exactly how you can fix them. So healthcare product management is different. You're not just shipping features. You're navigating clinical workflows, regulatory risk, data integrity, maybe HIPAA compliance, payer-provider economics, and maybe stakeholder resistance. And if your resume doesn't reflect that complexity, you look like a generic product manager trying to break into healthcare. So let's fix that today. Mistake number 1 is writing a generic product management resume. So you don't want to be generic. You want to get to the healthcare product management facts. If your resume could apply to fintech, e-commerce, or SaaS, it's too broad. Too many things it can apply to, right? Healthcare hiring managers, they scan for domain credibility within seconds. And if they don't see it, things like clinical workflow exposure, claims data, HR integration, regulatory awareness, healthcare analytics, interoperability. Many assume that you don't understand the environment. So a quick fix is to translate your experience into healthcare language, things that the hiring manager is looking for and understands. Instead of saying something like, I led cross-functional teams to ship analytics dashboards, say something like, I led cross-functional teams to deploy claims-based analytics dashboards, improving payer-provider reporting accuracy by 22%. Specifically, builds trust. Healthcare runs on precision, and your resume should too. Mistake number 2 is ignoring healthcare stakeholder complexity. In most industries, your stakeholders are engineering, their design, sales team, sometimes leadership, right? So there's a whole bunch of different stakeholders in healthcare that are on top of just a normal product manager. And those can be clinicians, compliance, legal, revenue cycle, data governance, executive leadership, and sometimes even external regulatory bodies. If your resume only shows that you've worked cross-functionally, that's not enough. So the fix here could be that to show basically that you understand multi-layered stakeholder environments. So for example, you partnered with clinical operations, compliance, and IT leadership to align product roadmap with a certain reporting requirement. That signals maturity. Healthcare organizations don't hire feature builders. They hire risk managers who understand system-wide impact. Mistake number 3 is there's no evidence of measurable outcomes. Healthcare is under financial pressure. Margins are really thin and budgets are scrutinized, especially within healthcare systems. If your resume is full of these different items like saying you supported this, or you assisted with this, or you contributed to, you look replaceable because you don't look like you're leading anything. Healthcare leaders want to see cost reduction, workflow efficiency, quality improvement, revenue protection, regulatory mitigation. And the fix here can be just quantifying business impact on your resume. Instead of saying something like you improved the reporting process, you could say something like you reduced manual reporting time by 35%, freeing clinical staff capacity and improving a certain submission of a document or a software or an application accuracy. Whatever you want to say there, but bring it down to some percentages and what it did and what the outcome is, all in one sentence. You know, it's almost like your elevator pitch when you're selling something. You're selling yourself, right? So create that elevator pitch for your different tasks or the different things that you've done that you want to really shine on your resume. Tie your outcomes to cost, efficiency, compliance, risk reduction, maybe patient outcomes. That is what gets interviews. Mistake number 4 is not showing that you can handle pressure. This is a big one. Healthcare environments are high stakes. Deadlines aren't cosmetic. If you miss a regulatory window, it can mean penalties. If you delay implementation, it can delay care delivery, and that is impacted and that affects patient care. If your resume reads soft, you won't be trusted with responsibility. And healthcare product management, every role, even down to an associate, carries a ton of responsibility. So the fix here is you want to demonstrate stability under pressure. An example here could be saying something like you led go live for a multi-site EHR enhancement across 12 facilities under a compressed regulatory timeline. Or something like you manage cross-functional crises response during claims processing system failure. Healthcare leaders are looking for product managers who can operate in ambiguity and in urgency without collapsing. So that is something you need to signal on your resume. Mistake number 5 is applying without strategic positioning. This is one of the most valuable things that you can do, but it's also one of the ones that most candidates miss. You're applying to healthcare AI startups, large healthcare systems, payers, digital health platforms with the same resume, but each requires different emphasis. Even though you're talking about healthcare product management, each environment has different focus. AI startups, you're going to want to highlight data products and experimentation. Health systems, you're going to want to highlight operational alignment and workflow integration. Maybe looking to work for a payer organization, highlight claims, cost containment, and analytics. And the fix here could be to customize your positioning. You are not just a product manager. You are either a clinical workflow optimizer, a healthcare data strategist, a regulatory aware product leader, a revenue protection product manager, or maybe an AI in healthcare product builder. Choose your narrative and align your application accordingly. So the reality here is that healthcare is evolving. AI integration is accelerating. Digital transformation budgets are tightening, and organizations are not hiring generalists. They are hiring domain-aware operators. They're hiring strategic communicators. And they are hiring risk-sensitive decision makers. Your resume is not a history document. It's not. It is a positioning document. So if you are not getting the interviews that you want in healthcare product management, it's rarely because you lack experience, because most people do. It's all how you frame it. It's usually because your application isn't signaling domain fluency, operational maturity, measurable impact, strategic positioning, or pressure stability. And if you fix even 5 of those things, you can change how hiring managers perceive you immediately. So there's so many things you could do looking back at these 5 mistakes to really clean up your resume, clean up the way that you present yourself, and get those red flags gone. If this was helpful, subscribe for more insights on healthcare product management, leadership under pressure, and decision stability in complex systems. Because in healthcare, pressure breaks most people. The ones who advance, they're the ones who train differently. So we'll see you all in the next video.